All right, hey guys. So my name's Tyler, and what I'm going to be showing you today is going to be a hip spica. So a hip spica we could use for an adductor strain, or we could also use for a hip flexor strain. And so that's going to depend a little bit depending on the stance. So if we're doing more of an adductor strain, we're going to have kind of the feet hip to shoulder width apart, and we want them to be equal as well. If we bring the feet closer together while we're doing the hip spica, it's actually going to cause more resistance, and if we go further apart, then it'll be less resistance as a result. You could also, if we are going to do a hip flexor strain, what we'd want to do is we'd want to have Amanda come more into a lunge stance. So if I did a hip spica in this position, that would help her with a little bit more of hip flexion once the hip spica has been completed. So, but what we're going to do now is we're going to do more for an adduction strain. For this one, we're going to have her hip to shoulder width apart. Another thing we want to look at is we want to look at having a heel lift. So essentially what the heel lift is going to do, it's going to go under the heel of the affected limb. This is going to allow her to have a little bit of slight knee flexion. And what we're also going to be doing is she's going to be coming into a little bit of internal rotation, but I'll explain that later as well. So what we have here is we have our 6-inch double elastic wrap, which is what we're going to need. So what we're going to do is we're going to start at the mid thigh. So what we're going to do is we're going to go around once. I like to go like this, not like this, just because that allows you to judge how much tension you want in your wrap. So what we're going to do is we're going to go around once. And now what we're going to do is once we come here, I'm going to put some tension, and I'm going to come across to her opposite ASIS. What I want Amanda to do is while I'm doing that, she's going to be bringing this hip into internal rotation. We want to make sure that she's not coming into a squat while she's doing that. So this could be strictly hip internal rotation. I'm going to add some resistance and I'll come across the ASIS. Another thing that I'm going to do now is I'm going to start to go around the back. I don't want us to be too low to start having interference with the glute max, but I don't want us to go too much over the iliac crest as well. So really where that ASIS is, and you're going to come straight across, so you can't see, but I'm coming straight across around. Now when I have my wrap is I'm going to come back down, and I'm going to do the exact same pattern. But what I want to do is the second time I go around, I want to always be a little bit higher than the last time. Something else, Amanda? Right now you're in internal rotation. As we came up, I want you to come out of internal rotation as I'm going here. So we're going to be coming back into internal rotation only as I come across your ASIS, okay? So I'm coming back down. Again, so now with this one, I'm going to become a little bit higher than the other one. So you can see this X is starting to happen a little bit higher. So again, Amanda, I'm going to have you come with your hip into internal rotation. Good. Apply some resistance in the wrap again. And again, ASIS. We're going to come around, not too high, not too low, and level with the iliac crest. And we are going to continue this pattern. So again, external rotation. Good. And we're going to continue that until the whole wrap is finished. So you see we have our herringbone pattern here starting to happen. And again, external rotation, good. Back around. And good. And so now this worked out nice, so that it's starting to our herringbone, our elastic band is starting to end at the thigh, which is what we kind of wanted. So what we're gonna ask is you can ask your athlete just to hold that there. And what you're going to do is with your athletic tape, you're just going to follow that same pattern that you did before. So what you're going to do is you're going to kind of start here, make sure that you lock the band in, good. And now, again, so Amanda, you're going to come into a little bit of internal rotation. You don't want to pull too much because the tape is actually going to have a large impact on how much resistance the hip spica and how effective it's going to be. So you don't want to go too tight, guys, just really to ensure that the hip spica is in place, and you're going kind of in the center of the wrap, so around the 3-inch mark. So good. So you come around twice, just like that. Sorry, Amanda. And so there you go. So now with this, what you're looking at is this is going to help you a little bit with the hip flexion as well, and as well as it wants to limit your hip abduction. So this is going to help with your adductors a little bit more. So how are we feeling? Feels good? And there you have it. That is the hip spica.